Original Medicare is broken up into two parts, Part A and Part B. There's a third part too, Part D, but we'll get to that a little later. Part A is the hospital portion of Medicare. Think of it as the inpatient part. If you're hospitalized, staying in a skilled nursing facility, or receiving either home health care or hospice, it will go under Part A. For most people, there is no monthly premium cost for Part A. It is paid for by the Medicare payments that are taken from our paychecks. If you've paid in for at least 40 quarters, 10 years, then your Medicare Part A is considered paid for. Under Medicare Part A, you have a deductible specifically for a hospital stay. Let's say that you go into the hospital on June 5th and are there for 3 days. You would be responsible for the hospital deductible for that stay. If you end up back in the hospital any time in the 60 days following when you were sent home, then you were in the same benefit period and your deductible has already been met. If it is more than 60 days from when you last left the hospital, then that is considered a new benefit period and you must pay the deductible again. If you get sent to a skilled nursing facility following a hospital stay of at least 3 days, then for the first 20 days of your stay, you will have no cost to you. From days 21 through 100, you will be responsible for a per-day copay amount. If you are there for 100 days or more, you will be responsible for all costs at that time. Part B, then, is the medical portion of Medicare. Think of it as the outpatient part. If you see a doctor or specialist, go to the ER or urgent care, need durable medical equipment, take a ride in an ambulance, or have any kind of outpatient test or procedure done, it will go under Part B. In 2022, as this video was recorded, the monthly premium for Part B is $170.10. If you are collecting Social Security, this will be automatically pulled from your check every month. If not, then they will mail you a bill for 3 months worth of coverage at once. These are the only two billing options for Medicare Part B. If your income is over certain thresholds, then you can be charged more for your Part B. That only affects a handful of people, so we can determine if you're one of them. Medicare Part B has an annual deductible amount that you would be responsible for. After that deductible has been met, then your copayment is generally 20% of the Medicare approved amount for whatever services you received. This is the real X factor of Part B. The physician or facility wants to charge a certain amount, which is probably more than Medicare's approved amount, so how are you supposed to know what your 20% is going to be? There's more to Parts A and B than what we have covered here, but this is enough to give you a good starting point. We can go into further detail with you when we talk. If you take only one thing from our time today, let it be this. Marketing companies make Medicare seem so confusing, but it doesn't have to be. Call us so we can erase that confusion.